Good evening.
Good evening.
So my name is Uresha. I'm a journalist. Have you ever heard of hpylori? Have you ever heard of it? What have you heard about it? What is it?
I just know it's a type of disease.
It is a disease. What about you?
I know the symptoms.
You don't know much about it. You just know it is a disease. It's okay. Sasa, umeisikia kuhusu hpylori?
Sijaisikia.
Hujaisikia? Na unadhani inaweza kuwa nini?
Najua. Siwezi jua kama sijaambiwa.
Na wewe tu hii hpylori kwa urefu ni Helicobacter pylori. So kwa maoni yako unaona inaweza kuwa nini?
Kama mmenieleza mzuri, ndio naweza jua.
Lakini huwezi kabisa,
siwezi elewa. Siwezi elewa hata kidogo.
Sawa. Sasa umeisikia kuhusu hpylori? Umeisikia nini kuihusu? Ni nini hiyo?
Hpylori ni bakteria inakujanga kwa tumbo, alafu ikishakuwa inakuwa kidoda, alafu after that inaletea mtu kansa kwa tumbo.
Sawa. Thank you. You could be having a friend, a relative, a sister, or maybe a brother who is suffering from loss of appetite or rapid loss of weight. There is this little known disease, Helicobacter pylori, in which many people are infected with it but don't know anything about it. It mainly affects the digestive system. Statistics show that many Kenyans are infected with it, but a little percentage knows about it.
Join me, Vivian Oresha, with the doctor of Mariakani Cottage Hospital as we get to know more about H. pylori.
I am Vivian Oresha, and so I've come here to inquire more about H. pylori. Briefly introduce yourself first.
Okay. Thank you, Vivian. So I'm Dr. Mwangi Lucky. I'm a medical officer, and I'm currently a general practitioner, and work here at Mariakani Cottage Hospital. And it's a pleasure to have you this evening.
A pleasure to have you too here. Okay. So, what is H. pylori? What is it?
So H. pylori is the common term, but H, if you can remember from biology, the scientific name you can shorten the first word. So H stands for Helicobacter. So in full it's Helicobacter pylori. So this is a bacteria that is found in the gastrointestinal tract of many individuals. It's ubiquitous. Ubiquitous means it can be found in many people, meaning if we are to test 10 people, at least around 5 of them will test positive for this H. pylori. So H. pylori is a bacteria found in the gastrointestinal tract in human beings, and it's not a good bacteria as many people.
Okay, and how does this bacteria come to the stomach or to the gastro?
Okay. Transmission of Helicobacter pylori, it's one which we can say fecal-oral or oral-oral. So fecal-oral means, in short, it's like you've tasted someone's poop, because you have to have contaminated yourself using this person's excreta. So fecal-oral means that either you could have contaminated, if you have it, that is, and someone takes it, or you've taken it from someone who has it and has contaminated something which you've eaten. So this means that if you use water that has been contaminated by, let's say someone goes to a river, defecates at the river, this person has this organism, then you are downstream, you eat it, you drink this water without treating it, definitely if it's alive, you're going to get it. So that's how you get it fecal-oral. So anything that will make you take someone else's excreta, so this person has gone to the washroom, hasn't washed their hands, has touched a surface, and you've touched that surface, you've gone, you've eaten without washing your hands. Basically, you've communicated that excreta from that person to your gastrointestinal tract. Oral, I wouldn't say that's so common. So let's stick on the fecal oral. The keyword is contamination.
Okay. And can it be caused by other means? You've talked about contamination. Can we say that it can also be caused by maybe certain type of foods, like taking too much wheat or something like that?
Okay, that's a good question. It reminds me of how people say cold gives you pneumonia. So Helicobacter pylori is an infection. An infection means you have to get the bacteria. Okay, so there is, as long as something doesn't have that bacteria, you won't get it. So the answer is no. Helicobacter pylori is a bacteria, and you need to have an infection. You need to get it from someone who is infected. For any bacteria, there needs to be a host. There needs to be a host who has harbored it, has shed it somewhere, and you need to take it. So you cannot get this bacteria from an uncontaminated substance. So wheat will not give you Helicobacter pylori, not unless the wheat has been contaminated by someone who actually has it. No food will give you H. pylori. Spinach will not give you H. pylori. Beans will not give you H. pylori, because there are people who think that acidic foods will give them H. pylori. That is not the case. Contamination should occur.
Okay, doctor. And so what are the signs and symptoms of this H. pylori?
Okay, so H. pylori is a gastrointestinal bacteria. So you expect gastrointestinal signs. You need to start thinking about things like nausea. Are you feeling nauseated? Do you want to vomit all the time? You need to think about things like abdominal pain. Are you getting abdominal discomfort? You need to think of things like bloating. Are you bloating all the time? You need to think of something like diarrhea. Are you having bouts of diarrhea? Remember, diarrhea is not just passing watery stool. Frequency, diarrhea can be passing watery stool. It can also be passing stool multiple times. It mustn't be watery for you to say you have diarrhea. So all these symptoms. Now we have secondary symptoms that can occur as a complication of whatever is going on in the gastrointestinal tract. Okay. So if you diarrhea a lot, you lose water, you lose electrolytes. You'll get dehydrated, you'll have a headache, you'll start feeling fatigue, you'll start having body weakness and pain. All these things can happen. So generally H. pylori, you'll get all these non-specific symptoms, but they can be tied to a gastrointestinal symptoms. So yes, those are the symptoms.
And are there like the first signs or at the first stage and the last signs at the last stage, or they just occur once the bacteria is in the intestine?
Okay, that's a good question. So the signs will depend on what the bacteria is doing. Let's say if the bacteria causes gastric hypersecretion. Gastric hypersecretion is when you have something called gastric acid. Okay, it's usually HCl, hydrochloric acid. So it's in your stomach. That is the acid that you hear most people saying they feel acidity. So H. pylori has a way in which it stimulates the overproduction of acid. So if that is how it will act on you, remember, we are all different. We are in the COVID period. There are people who have presented through diarrhea. We have people who have presented with difficulty in breathing. We have people who have lost their taste. We have people who have lost their smell. We have people who have come with headache. And in the long run, you get to find that it's COVID. So we don't have specific symptoms that will say this is H. pylori. That's why you have to visit the hospital to find someone who can try and piece these things together. So the earliest symptom will depend on what exactly has happened. If it's gastric hypersecretion, definitely you'll start feeling like you're having something we call gastroesophageal reflux, where you feel like acid is coming up your esophagus. After eating, you feel like something bitter is coming up. You wake up, you have this bitter taste in your mouth. It means that acid has washed up while you are asleep. You can present with bloating. It means that you have a lot of gas. So it just depends on what the H. pylori is doing in your stomach as an individual.
And doctor, I know that you have had patients of this disease. So what is the major symptom which made them to come to you and know like it can be a disease? What made them to come to the hospital? What is that symptom?
Okay, funny enough, most patients who I see with H. pylori, they usually come and they tell me, because most of them come and they speak Swahili, so they just come and tell you, daktari, nasikia tumbo haiko mzuri. That's the main complaint. Most of them will tell you tumbo haiko mzuri, ama nasikia tumbo iko hivi hivi, ama nasikia, few will come and say I'm having abdominal pain. For you to have abdominal pain, the H. pylori must have caused the production of too much acid to burn your stomach, and you need to have an ulcer for you to feel pain. So by the time you get an ulcer, you must have felt abdominal discomfort for quite some time. So what's abdominal discomfort? These are people who start feeling like things are moving within the abdomen. That sound will go, that one. So that's how most of them present. Or I think basically that's how they present initially. Those are the ones who are keen enough to notice that they have these symptoms. The ones who come with abdominal pain, those are the ones who've been ignorant for quite some time.
And is it disastrous if left untreated?
H. pylori can be disastrous. There's some level of it. Depends on what you mean by disastrous. We have people who have been found to have a type of cancer known as adenocarcinoma, which can be aggravated by this H. pylori. And we have people who have developed ulcers because of gastric hyperproduction. Then you know it's acid. Acid in contact with your proteins, because this is protein. So acid burns your protein, you get an ulcer. An ulcer is burnt by acid, it becomes abnormal. Whenever something becomes abnormal, you're now risking developing cancer, because cancer is abnormal growth of cells. So your stomach is not used to getting burnt, growing again, getting burnt, growing again. So that hyperproliferation can predispose you to that. But in disastrous, you will range from bloating to cancer. In between, you can develop ulcers. It depends on how disastrous you think.
And how can it be avoided? How can this H. pylori be avoided?
Contamination, you avoid H. pylori. So in lay terms, you need to wash your hands before you eat. You need to wash your fruits, wash your vegetables. You need to eat food that you can trust, because for you to have H. pylori, it means someone must have contaminated it. So you need to ensure that the person who is feeding you is not someone who can rush to the toilet, pass their diarrhea, and come back and serve you food without washing their hands.
Okay, doctor. Thank you very much for your time.
Okay.
I'm encouraging everyone, before struggling with exercises and diets to gain weight, please get tested first. H. pylori is real, and it is a call upon everyone who has experienced these signs and symptoms to visit the doctor as soon as possible. Let's be cautious of our health status. Until next time, bye.